Wait till I hear the little. There it is.
Okay.
Awesome.
Who
Good
do we?
afternoon. Go, Sherry. You want to start? Or you want me to start?
I just want to make sure we have quorum,
Okay.
so that we can decide if we can move on to consent agenda or not. Mimi, you want to call out the names?
Yeah, so I see we have Esther. I saw in the chat we have Lee. Daryl, I saw joined. Kimberly, did Kimberly join? I think yes.
She is.
And again, if you guys just want to put it in the chat really quickly, if you're able to. And then do we have Kathleen?
No,
No? Okay, and Ross.
no.
Okay.
But we do have quorum.
All right.
Okay.
Awesome. So, good afternoon. Happy Monday, everyone. As we bring our advocacy committee to order, I am Esther Sani, newly elected chair. Excited to be in the space doing the work with you guys. Not new to HLA or CoC, but definitely excited about the work that we have ahead of us. So I'm going to go ahead and start with our mission. As we do in all of our meetings, we do not only read the mission, but we name it, and then the vision and our purpose. And so the mission of CoC is to coordinate all community partners, systems, and resources available with the goal of helping individuals and families to prevent, divert, and end homelessness in Pinellas County. Our vision is to make homelessness rare, brief, and a one-time experience. And then, of course, the advocacy committee purpose is to use data, research, Pinellas CoC members and provider input, and the perspectives of people with lived experience to advocate for the legislative and funding goals of the Pinellas CoC with policymakers and funding. Of course, my phone would ring right when I am doing that. Um, want to go right into our consent agenda, but I do. You did say we had some new people on. Sherry, should we do a quick round of introductions?
I think that'd be great.
Oh, awesome. Okay, all right. So let's go ahead. Open floor for everyone to pause a moment to say their names and how they show up in this space. And I'm seeing the agenda, so I can't see names. I don't know if they want to dive in or if you want to call them out, Sherry.
How about we call the first person and then that person has to pick the next?
There you go.
There we go.
So first person is Miss Kimberly Rogers. Haven't seen you in a minute, Miss Kim.
Good afternoon. Hi, everybody. I'm Kimberly Rogers. I am glad to be here. I'm the chair of the Homeless Leadership Alliance. I'm happy to be on the advocacy committee. I've been an advocate for housing first and for folks experiencing homelessness throughout my entire career, and I'm just glad to be here. So I'll turn it over to my friend Lottie.
Hey, Miss Lottie.
Hello. Hi, I'm Lottie Cuthbertson. I'm not going to turn on my camera. I'm not looking too well this right now. Well, I started with the Homeless Leadership Alliance, the CoC, when I was at Bay Pines VA, learning of several veterans that was living with, dealing with homelessness. And I've always been a supporter my entire 30 years career in nursing, always been a supporter of our vulnerable community. So here I am.
Thank you so much, Miss Lottie. Who do you call up?
I call up Dr. Monica Scola.
Hey, Dr.
Hi,
Monica.
everyone. I'm Dr. Monica Discolo. Sorry, my camera's off. I'm leaving another meeting, getting back to my home office so I can be on camera with you all. I am on the CoC board of directors. I was voted on recently. I was a member of the Pinellas CoC for some time and then was working in Tampa. So I was on the executive committee over there for the Hillsborough CoC, and now I'm back over in Pinellas. I have worked with advocating for a lot of different groups. I even in school specialized in vulnerable populations. So I do a lot of research surrounding vulnerable populations, and I work with individuals suffering from opiate use disorder right now. And I work for a nonprofit I volunteer for a nonprofit that serves women healthcare needs. So I'm just really big into advocating. So I thought this might be a good fit for me to come on and see what all goes on in your advocacy committee.
Awesome. Thank you, Dr. Monica. And I'm sure your call up is going to be, I don't know who it is. Did they put their name in the chat?
Lee Allen, is that you?
Yeah, I'm 580-4156.
Yepers.
That's me. Let me see. I was going to show my ugly face here. I'm actually in between meetings. I will have to apologize that I've got something at 3:40, so I may have to step off and maybe get back on for quickly. Anyway, I'm on the HLA board of directors for about 3 years. I got there because Amy Foster and I go back, about 10 years. And I followed her to Guardian ad Litem, and then she went to HLA. So she asked me to be on that board, and then she left. But that's another story. All's good. And advocacy committee is important because I think every city in the Pinellas County, all 24 municipalities should be contributing to, even if it's $100, at least something to help end homelessness in our county.
Absolutely. Thank you so much, Lee. I think we're twins in the space of, I followed Amy as well many years ago, and have been in and out. It was Amy and Sheila Lopez. And so sometimes they drag us and then they leave us, and here we are. All right, so let's go ahead and dive into the consent agenda. First
And
up is,
Esther,
oh,
I'm
go
so
ahead.
sorry to interrupt. It looks like Daryl, are you still with us or have you left? Because now we don't have quorum. But here's the good part. The only thing that I see, I believe, was an action for today. And if he was to come back in, then, or Kathleen or someone else, then we would have it. Is this consent agenda? Are the minutes and the summary?
Okay, so then let's do this, and we've done this before. Let's bounce it down, and go to our federal and HUD landscape, and then if he comes back on, then we can quickly just jump on for the sake of the consent.
That sounds good.
All right.
Okay, we'll have a work group. Okay, so federal and HUD landscape, we have the HUD CoC program updates. There's something that just happened today even. HUD dropped all of its appeals for FY25 NOFO. So far there has, which means that HUD was still trying to put out the NOFO that we went through 3-4 times over the winter, that was never, never went through fruition, that HUD was trying to appeal so that they could put out a NOFO just for projects that were expiring in quarters 3 and 4, which is the majority of projects that we have in Pinellas. All the projects that expired in quarter 1 and quarter 2 of the calendar year. So through their HUD math does not always make sense. Sometimes it's calendar and sometimes it's fiscal. But I think that they went ahead a bit quicker with the quarter 2. Any projects that were expiring in the second quarter of the calendar year, they went ahead and paid and conditionally awarded those. I say conditionally awarded because there's no contract in place, no money, nothing executed just yet. with their dropping the appeal, then they can go forward if it's not, in litigation anymore, then go forward and start with those contracts for like BOLI, especially, and then also with CASA and the HLA too, because we have our contracts end towards the end of the fiscal year, September 30th. We are anticipating for FY26 NOFO. So that's the NOFO, that notice of funding opportunity that HUD sends down for all CoC programs throughout the country. Typically, it's every year. This was supposed to be a 2-year term. So with renewals for FY25, we know there was a lot involvement around that, where HUD did still try to do an FY25 NOFO. We are planning already for the FY26, and we do intend, or do expect for it to come out at the very end of May, before June 1st. HUD's given indication that they may make it go through August, which would be actually a good thing, because most of the NOFOs and funding opportunities that we've been seeing come down from HUD, SAMHSA, and other federal agencies have been really like at the bare minimum period of time to turn around. And so putting on this process locally does take a bit of, it does take time. And so June, July, and August, that gives us what is typically given whenever we have this award process come out. They've also signaled that they would put out conditional awards and start beginning contracts by December. So that would be a very quick turnaround as well. Typically, the earliest we've heard is January, but usually it's around February, March before the recipients receive word that they're going to be awarded the funds.
Okay.
So that's
Sherry,
it for NOFO.
Sherry, I don't know if we want to pause there. I did see Miss Teresa Jones came on.
Good morning, Teresa, or good afternoon, Teresa.
Morning, Miss T.
Hello, everyone. How are y'all doing?
We're good. We're good. Do we want to go ahead and jump back up to consent agenda?
She not a voting member just yet. So
Okay.
that's one thing we'll work on soon. Megan Robinson, she had a form where people who had intention to join the advocacy committee, I believe they're supposed to attend one or two, I don't have it right in front of me what the charter says, one or two meetings, and then fill out that application. And so Megan is getting all that information to me, and so that we can beef up the committee more.
Okay, we probably want to. I think it was attend one, and yes, the application.
Mm-hmm.
And I know Miss T
Which
has
everybody here
attended
would
far
qualify
more
for
than
that.
one. Yeah, and she's also on the board.
Mm-hmm.
Go ahead, Miss T.
Thanks, Esther. I was just going to say that I really just attend as an interested party. I'm actually a member of the Data and Systems Review Committee. And like I said, I just attend these meetings when I can because
Okay.
I'm interested. And I know I'm not going to, and I apologize for being late on here, and I'm not going to be able to stay long because I've got to go to work here shortly. So I'm just here to hear the what's going on primarily later in the agenda. Hopefully I won't miss it.
Okay. Good stuff.
Thank you.
And so that's it for the NOFO. It's coming down. A lot of the changes that we saw happen through the first few rounds this year, late 2025, we anticipate to see again, with more focus on ending street homelessness, less focus or prioritization around permanent housing solutions. Housing first, of course, I can guarantee it's not going to be in this NOFO, and actually they're actively against it. And so I know the Funders Council is looking at other language to use to replace Housing First, and they are getting together in person in a couple of weeks to discuss that more. And but this has been a discussion throughout the entire CoC for several months now on how we approach that.
Okay.
So other signals with the feds, with HUD, housing assistance time limits and work requirements. We saw that in the previous NOFO. We are also seeing HUD put out regulations to review around or sending out notices to public housing authorities and others around these areas, including also citizenship verification and compliance concerns. So, uh, looking at mixed status households, and if one person is undocumented and the other household members are not, then HUD is looking at forcing the entire family to not have housing assistance. With the verification, I've talked with a couple of public housing authorities here in our area, and some permanent supportive housing BOLI centers. Talked with them as well to find out what would happen if this was to take place, because they were being told that they had to go verify all residents within 30 days, and based on something called the SAVE system, and making sure everyone would qualify. And as far as people who are in the housing right now within Pinellas County, there's not too much of a concern about there being a lot of mixed status, maybe another story. But as far as people who are receiving that type of assistance and being undocumented as the people on the leases, that is not something that is a real concern at this moment. The real concern is looking at all the other projects we have, and that HUD has signaled through the previous NOFOs as well. One of the questions was, can you guarantee that all of your providers throughout your CoC will use the SAVE system to verify immigration status? And the issue with that is that there are many issues with it, but the big issue that we have just logistically is that no one has access to the SAVE system. And so there's no mechanism for doing it that way. There are many other areas, things we can talk about around that as well, but just logistically, it's not even possible.
I want to lean in right there, Sherry. So I got a call on Friday from an individual who is here on at the time, a green card that was valid. It has since become invalid. They went in January to renew. It wasn't invalid until April 27th, I think. But they went in January to renew, and they're still in pending. They have a voucher, not through the housing authority, through one of the other properties that has the HUD vouchers, and they've already received notification if their housing is in jeopardy if they can't show that their immigration has been renewed. And so I think that we really need to be and we need to probably look at what that looks like and how can we advocate in that space, because everyone received the notification about the citizenship verification and compliance, and some properties are taking it even the more serious and aggressive. And here is someone who has a voucher, has children, did have a green card, is pending now into the 60th, 90th day of an approval, and they are housing in jeopardy because of this. And I imagine that, this is just someone who knows me, but I imagine that there are others in the same space. And how can we even capture that information so that we can advocate for them?
And I'm writing this down because I believe this is so. Depending on if the program receives HUD funding.
Yeah, the property has vouchers.
Okay.
And so, like, their expiration on their green card was the end of April, and they've already received notification, 30-day notification. But also included in that, they were to renew their license. They went to renew where typically, as long as they could show proof that they were in the pending status, they would renew their license. They were not able to renew their license. And also the housing jeopardy is in place.
I'm going to reach out to who I think the provider is, but also this is definitely something this committee can take on. But as far as what the providers are experiencing, then definitely a larger conversation with them as well.
Yeah.
So I'm going to escalate that to Providers Council.
Okay, thank you so much.
And it is something for us to keep a pulse on. The response, so when the public housing authorities received that notice, it's been a couple months. And it was like on a late Friday or Saturday evening, close to midnight when it came out. And there was a 30-day turnaround, and just calling to find out how they were doing with it at that time, it looked okay. But then, yes, when you're talking about pending or people, the process being slowed down because they're not going to be helped along, that does become another story.
And then one more thing, just in the space of what we're talking about, there was a new release that came through about AMIs, and I think that for the 30 to 60% AMI vouchers, that AMI has increased and is in detriment of having some individuals no longer be eligible based on their income. It's tied to the Florida Housing Finance Corp. They're releasing the new AMI, so we probably need to keep a pulse on that as well.
I'm going to tuck that in. Thank you for that. Okay. Anything else so far?
I don't know if anyone else has anything.
I was trying to find my speaker button, but Esther, can you explain that a little more? Are you saying that if the AMI for 30 to 60 has increased?
So it's the income eligibility that is increased, effectively making and I don't have all the information. They directed me to the Florida I'll tell you exactly what it is. It came through the NAACP channel. They directed us to the Florida Housing Finance Corp that they will be releasing the new income guidelines, but it's going to affect individuals who are currently eligible, deeming them ineligible based on income.
Because the area median income has increased. So people are making more money. And so if you're typically below 80%, you don't really qualify for anything. And 30% below is like severely low income. And so it affects eligibility criteria, or who would be eligible. People who used to be eligible are no longer eligible, would be the case, because the area median income has increased, but it's still the 30, 60%, the 80%, all that is still in place. It's at the it's like the poverty level changing year to year, the federal poverty level.
And I'm on their website. It looks like they have a notice of some rule development processes. I probably need to go through them. And I think this may be the one. It's a hearing that's going to take place on the 28th, and I think that's when they're going to firm it up. But I'll take some time to go through it, and Sherry, I'm sure you will too. We can talk about it.
Okay. And then finally, for the on the federal side, the FY27 executive budget proposal came out, and it looks just like last year's. Again, this is preliminary. It requires congressional approval, and we know that the House and Senate, they'll go through their process for appropriations. Last year, as this year, the CoC program was put on the chopping block in favor of taking those funds, and this is a big one. So removing CoCs, which is local control, local response, and coordination, and taking all those funds and putting them into state block grants for emergency solutions grants, and that's ESG. And ESG is not for longer term support. It is emergency solutions. So that is something we definitely need to watch for. At the bottom of the agenda, you'd notice there are links. So if we send out information at every single committee meeting, we sent out like the Road to Housing Act recently was passed by passed by the Senate and was now in the House, and which is like largest affordable housing legislation that's even moved forward in decades. And so there are some areas in it that, there may be contention, but overall, it does provide for some relief, not financial relief, but some easing or updating of regulations and things of that nature. But if you look at like the National Alliance to End Homelessness, they send out the National Low Income Housing Center. They send out a lot of good information as well, just to keep it track of. Teresa.
Thanks, Sherry. I raised my hand because I think back to the days when we had some limited ESG funds from the city of St. Petersburg to assist with the funding of rapid rehousing that was in addition to the funds the city budgets in our general funds, and we ended up not being able to successfully spend those funds for rapid rehousing because they seemed rather restrictive in terms of all the requirements for qualifying individuals that were the recipients of those funds. And what I'm talking about is, it may have been staff related. Let me start with that, because we did used to have a city staffer who it was sort of difficult to convince her that folks, she just seemed overzealous, if you will, with documentation. Esther, I don't know if you remember this.
I remember. I was getting ready to say her name, but I'm doing.
I wasn't even here, and I know who you're talking about.
Oh, well, I'm going to say her name. I don't work at the city anymore. I'm talking about Lynn.
Yeah.
And I don't think she works there any longer either. But I'm just throwing out the caution that, we need. I know I'm preaching to the choir. We need local control. We know what's going on in our own community. And when the state is involved, particularly in today's climate, I think it's going to be just a wrench into things that we don't necessarily need. There's already enough obstacles to trying to take people from homelessness to housed. And that's not just the federal requirements. It's the cost of housing. It's the lack of employment that can effectively help people be able to afford their housing. It's just another obstacle. And I don't know how we might. I know we're going to continue to monitor it, but I hope that it doesn't come to where this state will regulate through ESG funds about how you address homelessness in local areas. Thank you.
Thank you.
Not to bounce back, but I wanted to share it just because I got it. So it was the HUD income limits regarding what we were talking about. And Kim, this is for you as well. In the Tampa, St. Petersburg, Clearwater area, the median family income right now, or based on the increase, is $104,700. So when we think about that's the medium family income, that affects that AMI and those income categories for the very low, extremely low, and then the 80 percentile. So when people or individuals are looking to get into housing, um, and they have to fit into what those AMIs say, um, there are going to be individuals that are going to fall out of that income bracket. So for a family of one, um, very low, they have to make or be less than 40,150. Extremely low, 24,1, and then low 80%, 64,250. I'm going to share this with Sherry, I think, so that we can just share it out to the broader group, looking at what the numbers are. We're going to have some individuals that are not going to qualify even for those multifamily and housing voucher programs. It's going to create a challenge, especially with them raising that medium income.
So Esther, are you suggesting that they're going to be over income or under income?
They're going to be over income.
All right, thank you.
Sherry, I'll send this to you. I don't know if we want to share it during this meeting. I don't want to hold the time up on the meeting, but I'll send this to you.
Okay. Yeah, and I'm going to be curious. We need to do some study on how many people, how many households that would affect as well. Because yeah, right now in Pinellas County, $108,000 for a family of four is just a survival budget too.
Mm-hmm.
And most people are not making that.
Mm-hmm.
So,
Agreed.
yeah. Okay. For some key state things, this will be pretty quick. Right now, the state is, so the House and Senate did not pass a budget, which is their one job. This happened last year too. Fortunately, this year, the session started earlier than last year. We were in early season. So, but finally, they agreed to a number that, a total budget number. And so there will be what is this, special conference that they get together and work that budget out. And that's scheduled for sometime it's going to be between May 12th and May 29th. How this affects us is that we do receive unified, it affects us in many ways, but one way directly for the CoC is the state unified homelessness grants that we receive from DCF, that HLA and the CoC projects receive. And last year we got notice, it was the day before July 1st. And so we were really scrambling and trying to figure out how to fund, and also just when you talk about contracting with the providers who receive these funds, the subcontracted providers, they have to spend it all within a year or they lose it. The whole system loses it. And if we do that over and over, that's no good. So we went into really high gear early, executed contracts, amended contracts when we had a moment to breathe for a minute, and we're spending down pretty well right now. But some other good things about this, though, even though they're going to these budget talks, just like last year, there were no changes or cuts made to CoC program funding. So we receive ESG, we do receive disaster rush, which is for disaster-stricken areas. That's non-recurring. That happens, as it's available or as a disaster occurs. So that's not something that we rely on. But ESG, the challenge grant, and our staffing grant, those are not going to be cut at all so far. And then also currently, there's no cuts intended for SHIP or SAIL. So those are the Affordable Housing Trust Fund. Those seem safe as well. There is one area where both the Senate and the House passed. It's SB 954. And they repeals 20% cap on manufactured housing and allows local governments to use 100% of SHIP on manufactured housing if they choose. So I need to find out more about that and see where it's at right now, if the governor was behind it or not. But that is one thing that came out of this session. There were a lot of other really good ideas out there, increasing accessory dwelling units for affordable housing, uh, the working with healthcare systems, having to work with homeless systems. We were going to be, Pinellas was going to be a pilot project, like I shared last time we met. We were able to convince the senators and the House Representative Rosenwald to put that on hold because there was like a serious misunderstanding. There just needed to be some more education on what the CoC does, what a lead agency does. And we can't be the care coordinators for the system, for the healthcare system. So going back to the drawing board and having meetings this summer, Rosenwald is planning on doing that. And so hopefully it will be coming back up next year, next session. Okay. Locally, any questions about state?
Well, real quick, do they include tiny homes in that manufactured housing concept?
That was actually, I want to say that was under the accessory dwelling units, the ADUs, and it doesn't look like that was moving along. It just didn't make it to the very end and wasn't passed in time.
Okay.
So I would expect that to come back too.
Okay.
That's with the most recent breakdown that I have,
Okay.
which was all the way up to where they were just stuffed on the budget or at a stalemate. Local update. COC Funders Council, we are sharing across all funders any funds that are available because we're looking at the NOFO, making sure everything's right size and funded the way that we as a community believe it needs to be done and coordinated, that there's not duplication or over extension in one area and a gap in another. And so we have been sharing with providers as well the investments inventory and getting those in alignment. Again, we're going to be talking about that when the funders get together in person in a couple of weeks. And also Pinellas County, their annual action plan. Joe Riddle shared that will be going live for public comment. If it hasn't already, he said soon. And so as soon as I know that has actually gone out, I'll send an update to everybody about that opportunity. Does anyone know? Have you received anything yet? Because I have not. Okay. Making sure I didn't know. And that's it on my end.
Alrighty. And so then diving into our advocacy priorities, this is where we wanted to, are we pulling up the link? Are we just kind of having the open discussion?
I believe that for advocacy, this is a good. I don't believe this group has dialed in exactly what it wants to work on next. Last meeting, yeah.
Okay, so this is the open discussion where we kind of look at the climate, look at what's happening, where we're landing. Sherry just kind of gave us an overview of what's funded, what kind of didn't make the funding pool, and how our local area looks. I would imagine, and Sherry, I did send you that information in regards to the HUD income guidelines. I would imagine that this group really needs to look at those things that are going to are actively affecting individuals in our community. And so, and then when looking at it, how are we going to forward face that and push it forward as a specific priority for us in the advocacy space? open discussion, thoughts, points that have come across your phone, desk, in regards to issues or concerns, and then we can begin to build out what will form into a firmed up work plan of our priorities. And I can start. I think we really need to take a heavy eye look on individuals that are going to be affected by this citizenship piece. Green card holders, the youth that will be affected if the adults lose housing, and collecting the data, reaching out to not just the housing authorities, but those properties that receive HUD funding for housing and housing choice vouchers, so that we can capture the data to enable us to have a clear understanding of who's being affected and how we can stand in advocacy for them. So that would I think be a priority for this committee. And then I'll leave it for anybody else. Or if someone thinks that shouldn't be a priority, I want to leave that open as well.
I agree. I like that idea. I'm just wondering, could we have a discussion on, or is there enough information at this point to know exactly what our end advocacy game would be? Because it sounds like a lot of what is happening as it relates to people that this is affecting is coming from HUD and the federal government. And I know our committee is, or at least we talked prior to this meeting about trying to focus on local and advocacy efforts. So I guess I'm wondering, like, what would our local response to this issue, what would that look like if we were to have one?
So, Kim, off the top of my head, I think of some of the initiatives that are coming out of our many municipalities in regards to how they are addressing housing and developments and etc. And if there's a way that, and this is pie in the sky, if there's a way that we can have levels of collaboration with entities, or a entity or a funder that will provide some level of support for these families. I am a firm believer, and just locally, that if one person came across my desk, then there's probably 20 others that don't know, or more, that don't know where to go and what to do. And so how can we provide them avenues of information, avenues of support and advocacy, whether it's education or direction or legal, or the many ors that can come in. How can we stand in that space for them? I think people only know what they know, when they know it. And so how can we stand in that space? And so maybe this is something that we need to take some time to think about. Sherry, maybe we can look at putting together a document of local and statewide movements, I'm saying movements for lack of a better word right now, that are coming down that will affect the population that we are targeted to provide support for, and then we can push it out prior to our next meeting, um, and get the feedback from the committee, and then we then will look at what the majority focal point is and move that forward as a priority work plan.
Hey, Esther, this is Lee. Can you hear me?
Yes, Lee. Hey.
I think that we could do it a little fast. I mean, I like the idea of pushing something out to the committee reviewing, but we could turn that around quicker than before the next meeting, I guess, is what I'm thinking. Not that we discuss it, but have it a lot farther along and then basically hopefully approve it at the next meeting. And then instead of hashing it out at the next advocacy meeting, get comments, then send out a next draft and maybe have it all ready to roll by the next meeting.
I agree. We can do one thing.
Probably basically the same thing. Yeah. And to piggyback on what Kim said, one of the focus I know that we've been trying to do is get, like I said, a broader participation by all our communities here in understanding homelessness doesn't end at the city boundary.
Agreed. We can definitely. One thing Kathleen taught me is she believed in ad hoc subcommittees, and so as do I. And so we definitely can put it together, push it out, work out the semantics and the kinks of it, and have it ready as an approval item at our next meeting. What I also would, and I'm just throwing ideas out, I'm thinking of how I've shown up in different spaces with HLA and CoC, is how can we, as you said, Lee, and Kim as well, get broader involvement. And so I would like to see how we can be more inclusive in getting people involved. The application was not maddening for me because I'm used to it, but I would like to see if we can get some younger voices to the table. I have some high school youth that I believe would be willing to lean in with their voice in this space.
That sounds like a great suggestion. Yes, let's not put hurdles up for people to get involved.
Yeah. So we can level set with that, and Sherry, you and I can come together, and I can create a doc, or we can come up with some ideas and push it out, and then find a space where we can do just a work plan group where we put it together to bring it to the broader committee as a ready to go as long as it's voted on and move forward. Okay.
I'm wondering, is there anyone here who wants to join in on that?
I'll definitely be in on it.
I'll be in also since I suggested it.
Yeah, that's right.
Yes and yes.
Thank you, Lee.
All right. Anyone else who feels that they would like to, please let Sherry or Mimi know, and then we will move it forward. Sherry, we can talk shortly after and see how we can roll that out.
Sounds good.
All right. And so next up on the agenda, we had committee structure and engagement. I feel like that kind of aligns with what we were talking about a little bit just now. Am I wrong, Sherry? Or go ahead and correct me if I am.
I think you're right. So we can change the way that people join the charter. Of course, there's seated voting members, and then there's Teresa Jones, who shows and participates and gives our ideas and can work on a work group and all of that.
Mm-hmm,
Uh,
mm-hmm,
but there is definitely room for more seated members. We also, we don't have a vice chair right now,
mm-hmm, mm-hmm.
and so that there's an opening for that.
Yes,
But I
ma'am.
also wanted to just throw in there if there were any other advocacy priorities in addition to immigration concerns that anyone wanted to tackle.
I feel like those are the ones that are like so prevalent and so heavy for our community. But we can definitely come up with some other ones and push that on the forum as well and vote it up or vote it down. Okay. All right. Should we move forward? I
Well,
don't
I
see
think there
anything.
was
Okay. Go ahead, Kim.
this might be covered later on, but I think there was some discussion at the last meeting about our committee possibly advocating around some local legislation that would, I guess, mandate that um, that there be advocacy regarding what's the word? Discharges from hospitals.
Mm. Yeah, that's a huge one. That's been going on for a minute. Are you talking, Kim? Are you talking about when um, hospitals just discharge individuals whether they have a home address or not?
Yes.
Yeah,
Okay.
and not alerting the providers that they're doing it. There's no
Yeah.
coordination, and that goes back to those bills that came out during this last session in Florida, uh,
Did
where
those get?
hmm?
Yeah. Did those bills get voted on, or are they
No,
still?
and
Okay.
thank goodness. I'm
Okay.
just speaking very candidly. This was shared to last meeting, but I just wanted like to recap it. Uh, the the bills that came out were excellent intent and are needed for sure. That is an issue, but the implementation. So at first it was going to be statewide. Every single COC was going to be required to, and every health institution that was funded by the state would be required to go through this process. Then it went away because there was COCs were saying we can't do all of that. I was notified that Pinellas County was chosen as a pilot, one of four pilots in the state, the day that it went out on the floor. There was no discussion about it beforehand.
Oh
And
wow.
so reading through it, it was going to require that the HLA, the lead agency, uh, bring in every hospital detox ALF in Pinellas County into HMIS with the few staff that we have to do that. But so basically not understanding what the process was and how big a
Right.
lift that would be. There was no funding attached to it whatsoever. And we would also have to we'd have to manage care coordination. HLA, the lead agency, would have to receive referrals and then do the coordination with all the providers
It's
in Pinellas.
impossible. It's impossible.
Impossible, right? And outside our role. And so it turned into when I saw that, I wrote to the Florida Coalition on Homelessness, the lobbyist, Brian Cherry, and Don Gilman, she's up in Jacksonville, and Jacksonville was one of the pilot projects too. And I said, serious concerns about this. We need to talk. And so we got together over MLK weekend and I offered up we met and then I supplied some additional language. Rosenwald, so Rasan he's termed out after
Mm-hmm.
this. Rosenwald, he's a social worker. He's worked in healthcare before. He's out in Broward. Yes. And they have a system going. It took them years to get their system.
Yeah.
And it's a county-run system, not the nonprofit lead agency. So it very different landscape entirely. And so that's what he was going for 1 year though to get something like that going. And um, so I did some revisions. I educated on what a lead agency does and some ideas on how this could actually work out to just getting hospitals discharging to maybe let the COC review some of their discharge plans and give comment back and requiring that they do reach out to providers in their discharge planning because they have much more resources for that. They have more case managers in their system than we do in the homeless
Of
system.
course, of course.
And so putting that where it belonged, and then finally putting this where it belonged too, they required the lead agency to do the final evaluation report of the whole thing, like collect all the data and report out to the state. And instead change that to DCF would do a final evaluation on the pilot, and Rosenwald accepted all those revisions. And then I think that he heard from other stakeholders or possibly the hospitals and decided that cart before horse. Need let's pull this back for now and have he's going to meet with stakeholders over the summer to dig
So,
deeper into it.
but while they're doing all of that, hospitals are still releasing
Mhm.
individuals without known address just on the streets. I remember when I was over homeless services some years ago for St. Vincent de Paul, they would give them a taxi straight to the door and say, "Figure it out." Um, wow, I'm shocked that it's still happening. And so, yes, I agree, um, Kim, that that absolutely still needs to be a focal and
Mhm.
priority point for us. I wonder if there's a
Yeah.
way. Go ahead, Kim. Go ahead.
No, I didn't mean to cut you off. Go ahead.
No, I was gonna say, like, I wonder if there's a way, from the municipality side, that there's an avocation space, to fiscally support a, I don't know, a liaison. I'm just throwing it out there. A something that would be that intermediate space in between the hospital and sorry, the providers, and their role is to do the connections and the calls and to gauge, like, I don't even know. I'm so on the programming side removed from homeless services that I'm not sure of even if that's in place, but it seems like it's something that we can definitely begin to have the conversations and see what can be done while waiting on them to do their, what I call,
Mhm.
mud bath of legislation.
Hmm.
But go ahead, Kim.
Yeah, I like that idea as well, and I think that maybe trying to gather some data on like what hospital is most, the most chronic hospital in terms of discharging people like that, in the way that you described, Esther, and then maybe trying to um, figuring out how maybe a provider in conjunction with some local municipality can collaborate with that hospital to try to make that situation better. And I think we had talked at the last advocacy meeting about, um, and I think I'm moving ahead, but um, reaching out to Allegheny Franciscan Ministries, because I know that they fund, or they're concerned about homelessness in Pinellas and Pasco and
Hmm.
Hillsborough, so maybe they might be interested in a project like that.
I think it makes sense for us to really look at, um, who would be interested, but also like who would fund it. So I'm thinking of the county, right? And it would make sense to me, municipalities, individual, yes, but it would make sense to me that there's conversations with the county on where they land with that, and if there is space or room in there to tap into funding to support um, an Allegheny or another organization to fund that position that is that liaison position for the county, and they rest there now. I know it's I'm simplifying it. I'm certain it is far more intense as a grant writer. I know that it's far more intense than that, but I'm just thinking, um, how can we begin the conversations? I think that absolutely needs to be on our purview.
I'll raise few things here. One is so getting hospital data very difficult, but so
Mm-hmm.
we could try to go through providers. We've had these conversations to find out like where people come from. I don't have anything that's like definitive on which hospital, how often. It's very like one at a time anecdotal, right? Which is enough if we had enough, like if there was if it met a certain threshold of this many stories, okay, if everybody knows, and then great, we, moving forward with that. Um, the and the county, I think that that's a good place to have a conversation. We meet with them monthly and
Mm-hmm.
raise concerns for them to put forward in their budget proposals to the commissioners. Um, it takes a little bit of time, but that is another avenue. Uh, there's a The COC is undergoing a strategic planning process right now. And so everyone's going to be receiving a survey and or an interview or have other opportunities available to them from Stephen Ferrante. So when you receive anything that says take this survey for the strategic plan, I think that this is an area to raise in that survey as well
Okay.
so that it can get into the plan. Uh, and finally, our healthcare seat on the COC board has been vacant and not for lack of trying. Kathleen and I have reached out and reached out. And um, we were able to fill two business seats this year, which was great because those have been vacant. And so maybe we'll have that same, the right people will come around. But that is Dr. Monica Discolo being one of them. There we go. Uh, and we had Esther, of course, but like just having those all the seats filled in that area because it's so important, especially when we know it takes more than just homeless services to get people housed and
Mm-hmm.
maintain housing,
Mm-hmm.
especially in Pinellas County and where the AMI is so high and the wages are not meeting that.
Right.
And so uh, that's another thing is to really, if you know of anyone who um, works at one of these Baycare, for instance, we know we have friends at Baycare, but who have that sort of that are in a level where they can really influence the whole. So at those higher levels who can serve on the board, that would be excellent. Um,
Hmm. You
so those
would
are just
you
some
would you
ideas,
would
but
you would imagine that it wouldn't be so hard because it's such a prevalent um, issue in and around our community. At any given time, at any given drive, you can see our unhoused brothers and sisters there, and it should be critical, um, a critical point. But I also know, having worked in this space for so long, that it is not critical sometimes. It doesn't mean that we don't stop. It
right,
just
right. And
means.
and I'm wondering, so when you look at two different systems, healthcare and homelessness services, or
Mhm,
child welfare and behavioral health, and
mhm,
shares the same clients, cares about, so caring is one thing, but how to act when systems don't talk to each other, Not because they don't want to, because they each have their own regulations. They each have their own requirements that go on that get in the way. And
Right.
one side doesn't know about the other side's issues. I remember working with child welfare and doing integration with behavioral health. And there was this real misunderstanding about substance use disorder and how federal law really, like it's tougher than HIPAA. You
Mm-hmm.
cannot share that information.
Right.
And so there was, when data sharing agreements, that was always an issue. And so we had to have education around this is what the law says and why we're restricted here. And so let's talk about like other ways to partner. Um,
Right.
Something like that. So even having those conversations with the hospitals to find out um, and there was one in January of 2025 at the CLC board meeting. There was a conversation with our last healthcare representative. That was the last thing she showed, but this topic came up, and she talked about you know what the discharge process was like and what was
Mm-hmm.
required for it, and they can't just keep people if there's nowhere to go unless there's a medical necessity.
Right.
So I think just even getting to understand each of the systems is another piece.
Agreed. Agreed.
Hi, this is
All right.
Lottie.
Hi, Lottie.
Go ahead, Miss Lottie.
Um, well, I want to go back a little and where you were talking about, well, you continue to talk about the hospital, the relationship with the hospitals and the patients being discharged and having nowhere to go. Um, let's say we look at Baycare.
Mm-hmm.
If if we look at Baycare, the start.
Mm-hmm.
Um, would we consider doing like a pilot program with one hospital, not just the whole unit, and then see how that goes, and then we can, add on the other hospitals and maybe send it out to Orlando Health. Um, so because um, I don't think it'll be something that we'll be able to initiate with the entire Baycare system, 12, 13 hospitals. I was thinking maybe a pilot program, starting with one hospital and, shaping it from there, and communicating with that hospital and then, branching it out.
Yeah, I would say healthcare history has taught me in healthcare that they all kind of sort of sit back to see who's gonna do it first,
Hmm.
and then when it's done well, then they say, "Okay, I'm on deck." So I think the way you're thinking is accurate, Miss Lottie. Once we're able to firm up what it looks like, right? How it rolls out, what is the funding going to be, who holds it, right, who owns it. I do think then it's the conversations of who will be the guinea pig, for lack of a better way of saying it. But I think it also begins with getting somebody from those healthcare institutions in the seat on the board, because that's your end once they're on the seat. So I heard you, Sherry, when you said that healthcare seat has been empty for a while. I wonder if it's beneficial to talk to the Foundation for a Healthy St. Pete team, because Baycare for the last 4 or 5 years has been a very intentional partner with the work that they're doing there. And I wonder if there's a way for us to have the conversations and get an in with the Baycare team that way. And again, foundation is, the emissions are different but the same, in the space of they are centrally focused on a healthy St. Pete, in particular certain zip codes in St. Petersburg, but healthy St. Pete nevertheless. And homelessness is of course, as we know, a detriment to the healthiness of the city. So I wonder if there's a way for us to utilize that to um, build a bridge by way of foundation into Baycare. And I would be more than willing, not just talking about it, but I'll be more than willing to do a connection conversation if you don't already have that connection.
Oh yeah, we have connections with Healthy St. Pete. I actually even talked about their that was kind of thrown around a little bit about their filling the seat. I know their connection with Orlando Health or Bayfront is, and so
Oh
are they
yeah, yeah. I
also
meant to
working?
say Orlando.
Well,
Apologies.
I was
Or
going to say because that'd be, but with
in Orlando Health, I mean, it's Bayfront. It's all of our health. So if we could have that conversation with Foundation, I wouldn't imagine they would fill the seat because they're not technically
yeah, we
a healthcare business or facility or organization, but the work that they've done in partnership with Orlando Health should certainly elicit some type of a warm connection to them to then begin to have the conversations about their willingness to sit at the table. And as we know, once you get somebody at the table, then you pretty much can get in, and then that leads into what Ms. Lottie was saying in regards to the pilot
I
conversation.
think so. Yeah, looking at Orlando Health, I literally, my husband and I spent a year in that hospital and we were celebrities there. So we're going to use that with Foundation for Healthy St. Pete. That was one strategy at
Yes, 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 and
several months
yes.
ago to try to fill that seat.
And I
We'll
think,
look back into that again.
well, I don't only think I know that there's a awareness piece or a lack thereof. You're talking about the healthcare industry, and they are aware, definitely aware. We all are of the homelessness in the community, but there are so many um, physical and mental health issues that they're dealing with. Not that they pushed it under the rug, but they're fighting those. So when we bring that back to them, what about this? This can be also be um, you know, we talk about health related condition. Of course, homelessness is related to some of these health related conditions. Sometimes you have to bring it back to the forefront, like you're saying, getting someone there that's in a status that can bring it to the body.
Mm-hmm.
Um, I think it's just like of awareness how bad it's getting to this point. So having that conversation and making the healthcare industry aware of where we're at now with homelessness, and um, I think we can go forward from there. So I just had to put that plug in for the healthcare communicating with them all the time, knowing that it's so many issues that's on the board for healthcare, keeping their license, being able to do certain procedures that they've done for years and not, fighting for these things. So I think it's got swept under the board. So just bringing it back to the forefront for them.
Yeah, I agree, Miss Lottie. I think we get so centrally focused on what our focus is. It's not that we're ignoring all of everything else, but like when you're in your field, you're just very centrally focused on that. And I think it's the same for the healthcare. It's the same for social service. However you land and fall, um, you get very centrally focused. Other stuff is happening, but you get centrally focused. I think we can land there, Sherry. Um, and begin to have those conversations. Introduce that sub ad hoc group to kind of pull together what those um, focal points slash priorities will look like. Push it out, and then have it ready so that when we meet again, we're ready to hopefully move it forward to the greater board. All right. So next up on, hopefully we're good with that. Next up on our agenda is World Homeless Day, August the 10th. sorry, August the 10th, October the 10th. Um, I don't know if we have any open information in regards to that, or if it's just a FYI.
It's sort of an FYI. It's something that I know other committees are starting to look at ways, and we're just collecting ideas on what we may do as a COC. And some ideas I know that have come from our end is that as letting providers know that it's happening and funders, so that if providers are doing something, or if any organization, any community group is making sure that they're aware of it, right? But also if any community group is doing something, that we can know about it and maybe collect all of the work that was done and broadcast it, ahead of time so people are aware. Also getting proclamations signed
Mm-hmm.
that day or around that day. Uh, that's we're just trying to collect any information we can get on what how people are responding to World Homeless Day. May never have heard of it before, honestly. I had not. Not this particular one.
Mm-hmm.
And so that is, I know that the county is looking at it as well, and so we'd like to actually just increase awareness that day.
I wonder if we can do some type of a community organized event around that. I'm just looking at the calendar real quick. So October the 10th is a Saturday. Um, I wonder if we can do something community wide and bring community providers together. I know providers are always looking for volunteers, always looking to be intentional with showing the community how they're showing up for, again, our unhoused brothers and sisters. So I'd love to see if that's something that we can be forward facing and intentional about pushing out. Some type of a collaborative day. It's a Saturday. Would be nice.
Mhm.
I would love to assist with that.
Okay, awesome. Yay!
Who
So that
said that?
I think that was that Kim or Miss Lottie? I think that was Kim.
That was Miss Lottie.
Oh, Miss Lottie. Kim said wasn't me. What?
Not that I'm not willing. I just wanted to clarify.
Kim said,
That
don't give me.
Kim,
Kim
that
said,
was
don't give
fast.
me. I mean, it was real fast, Miss Lottie. She said, don't do that. Not one more. Not one more thing. I love it. I love it. That's funny. All right, so next FYI item is National Association of COC Leaders. This is forming, more information forthcoming. As it firms up and forms, the information will be pushed out to this body and I'm sure to the broader board as well and the executive committee. And then according to our agenda, that is all that we have. We'll move to close and adjourn if there's nothing else that we need to tap into.
Well,
Awesome.
Esther, I just appreciate your leadership in this committee.
Thank you, Lee. I appreciate you. Thank you so much.
Yes.
All right.
Me too.
I'm gonna give a whole 38 minutes back. I love meetings that give time back as opposed to the ones that take time away. So listen, thank you guys so much for trusting me in this space. I look forward to doing the work with sleeves rolled up and tennis shoes on. This is we don't do it just because we don't have anything else to do. We do it because our hearts are in place, and we believe in making homelessness rare, brief, and a one-time occurrence.
But hey, Esther, just I guess my food for thought.
Yes.
I always question the need for a 2-hour meeting, and I think sometimes that may scare people away from participating in the meeting.
Mm-hmm.
I think the goal ought to be an hour and 15, hour and a half, and that way, if you put it out that way, I hate to say, you might get more participation.
Lee, I believe. Listen,
I concur.
I am the I'm I think I've said this. I'm the president of the NAACP, and my executive committee meetings are an hour 15 tops.
All right.
I believe that the work needs to happen, and we move forward. So I am in agreement.
But then on the other hand, I don't mind meeting more frequently than quarterly or whatever. I'd rather have more frequent meetings and shorter meetings.
Agreed. Agreed. Oh, so that can actually let's tap that back up, Sherry, into committee structure and engagement. And so
Okay.
maybe we need to look at more frequent, but more less time.
Yes.
So an hour tops 90. I'm thinking an hour 90 minutes probably is too long. I would say
You're
like an
thinking
hour.
75.
Yes, 75 minutes. Really, let's go an hour with the knowledge that if we have a lot, 75 minutes. And then we can really get some things done. I agree that we'll probably have a little more participation if it wasn't as long, because it's a big gap. It's a big gap when you say a 2 hour block. All
Thank
right,
you.
more information coming on that. Absolutely. All right. So with that being said, we will adjourn our meeting at 4:25 p.m. Additional materials and resources are on the agenda for your purview. You guys have a great rest of the day.
Bye-bye.
Bye bye.
Yeah, great meeting.
Thank you.